Hello all, my name is Chase Vincent and I am a pharmaceutical researcher at the University of Florida, and I'm going to be presenting a proposal for more funding towards Remdesivir, or commonly known as Veklury. So what is Remdesivir? It is a prodrug that works for RNA viruses by disrupting their replication cycle. It enters the cell and becomes phosphorylated to create nucleoside triphosphate. This mimics ATP within the cell, which allows it to embed itself into the nascent RNA strand. Once integrated, it inhibits RNA-dependent RNA polymerase, which stops further replication of the RNA virus. Regarding how it's administered, for people over 90 pounds, it requires a loading phase of 200 milligrams and then a subsequent 100 milligrams for 2 to 4 days. For people less than 90 pounds, that amount is 5 milligrams for the loading phase, followed by 2.5 milligrams per day for 2 to 4 days. And this all varies depending on the severity of symptoms of the virus. Now, this drug is employed mainly for coronavirus, which I'm sure doesn't need much of an introduction. It's a viral respiratory illness caused by COVID-19, also known as SARS-CoV-2. It causes symptoms such as fatigue, aches and pains, flu-like symptoms, nausea, shortness of breath, and in more severe cases, loss of taste and smell. This virus is predominantly spread through respiratory droplets either from person to person, airborne, and contaminated surfaces. Thus, the best way to prevent the spread is social distancing, masks, proper hygiene with hand washing, and vaccination. Like I said though, these are things that I'm sure we're all well aware of since the pandemic. Now back to Remdesivir. Its effectiveness against COVID is represented here in these graphs. According to a study published in the New England Journal of Medicine, 2 groups were assessed for receiving Remdesivir treatment and a group that did not receive the treatment. The Remdesivir group over a span of 15 days had a mortality rate of 6.7%, compared to the 11.9% in the placebo group. This goes to show that there was a reduction trend in mortality, proving that Remdesivir exemplified shortened recovery time in the hospitalized patients. In comparison to other treatments for COVID-19, we have Paxlovid and Lagevrio. Paxlovid is a combination treatment of both ritonavir and nirmatrelvir. These are oral protease inhibitors that are intended for people 12 years and older. Unfortunately, Paxlovid is known to have a rebound effect, in which post-treatment, which is estimated to be about 2 to 8 days, COVID symptoms can return, which is obviously unfavorable. Another problem with these drugs is that there has been very little evidence in reducing mortality rates in the elderly, meaning if COVID is contracted within the immunocompromised, this form of treatment is not effective. The other form of treatment is Lagevrio, which is the common name of molnupiravir, also an oral drug, but this one comes in the form of a mutagenic nucleoside analog. This treatment is only used for people ages 18 and older. Because the drug causes mutations in the viral genome, the drug is only intended for emergency use, and thus is not FDA approved. It also has several concerns for sperm production in men and potential birth defects for pregnant women. And lastly, children can't even use this form of treatment. With this being said, it's important when comparing complications of each one of these treatments to highlight Remdesivir's as well. Firstly, it's administered through IV only. There are no oral pills for this drug. Secondly, there are some concerns over its possibility for kidney damage and toxicity. I will address both of these concerns later in the presentation. And lastly, it's costly, another concern that I will address shortly. Overall, though, we can clearly see the benefits of Remdesivir's treatment over these other 2 options. And just to reiterate its benefits through comparison, here we have a chart from a study published in Science Direct, in which they compared Remdesivir to the other 2 drugs mentioned before. As you can see, Remdesivir presented a higher p-score, which translates to a lower probability of death than the other 2 drugs, indicating higher efficiency and reliability. To further exemplify Remdesivir's benefits, we can assess these 3 patients that are all applicable for Remdesivir treatment. Here, patient 1, they have moderate to severe COVID-19, they are aged 64 years old, and they are experiencing symptoms such as fever, coughing, and muscle aches for about 4 days, and they have become hospitalized. This patient would be eligible for Remdesivir treatment. Patient 2 has mild COVID-19 and is only 16 years old. They are experiencing symptoms such as nausea, vomiting, fever, and coughing, and they have been hospitalized. This patient would also be eligible for Remdesivir treatment. And lastly, patient 3. They have severe COVID-19 and are aged 72 years old. Their symptoms are shortness of breath, loss of taste and smell, and fatigue. They have become hospitalized and are on oxygen. this patient would also be eligible for remdesivir treatment. The last thing I wanted to touch on is the concerns I had mentioned in the comparison analysis, as well as some more pertinent information about the drug. Regarding remdesivir's side effects, there is the potential for gastrointestinal issues, such as nausea, vomiting, and diarrhea. With these being said, these effects are minor and are also quite rare in the generalized patient population. There have also been concerns regarding elevated liver enzymes such as ALT and AST. However, this was only present in more severe cases. And because of this, I believe the benefits of preventing severe COVID outweigh the potential risks. And lastly, there have been concerns with kidney damage. To reference, I will cite a study published within BMJ journals in which the researchers conducted 16 randomized trials with over 8,000 patients. Quote, compared with standard care or placebo, low certainty evidence suggests that remdesivir may not have an important effect on acute kidney injury. End quote. And regarding toxicity, there have been little evidence to support this claim, and thus it can be taken lightly. Moving on to drug interactions, it's important to avoid chloroquine and hydroxychloroquine, as both have been shown to reduce remdesivir's efficacy by altering the phosphorylation process of the nucleoside triphosphate. And lastly, the costs of remdesivir's treatment. It can be quite expensive. However, the treatment is covered by majority insurances and the Coronavirus Care Act. So while expensive, there are still ways for it to be widely accessible to the public, especially in more severe COVID cases. So, to summarize, remdesivir remains a valuable treatment option for hospitalized patients with moderate to severe COVID-19. It is well tolerated and the more effective drug when treating COVID-19 in adults and children, in comparison to the other drugs that are available in the market. Side effects are usually mild. Regarding more serious effects, studies show negligible risk of kidney damage or toxicity during treatment. So because of these reasons, I would advocate for further funding towards remdesivir's development. Thank you for listening.